Can you tell us about a time when you've made a mistake in your clinical experiences?
Okay.
And just so
I'll
you know, like the points for this and the rubrics is usually about like how you understood the gravity of the mistake and like how it could have been so much worse if it had been applied to like a medication error or whatever.
yeah.
And like what changes you make going forward so that like that confusion never happens again, kind of thing.
I remember I watched a lot of your videos and had come up with an example and I can't remember. I
A lot
don't
of people talk about like putting the wrong label on things or like
I
what
did
else?
I know it so at clinicals, when I did my preceptorship, they had me label a vial of blood, but it was the wrong patient. And I asked the nurse what patient it was for, and she like was rushing to give me an answer. And she was like, can you just bring it to the lab? And I was like, okay, but I just kept questioning it. And luckily, like because I went back and questioned her again, like we caught that it was the wrong patient that she had me write on the label. So that could have been really bad.
Yeah, yeah.
Yeah.
Um, hmm.
I did have a better example, but I can't remember what I had said. Or
Was it something about like um not like overextending yourself helping other people's patients too much? Was it that kind of thing?
I hate to say this, I've had a couple medication errors,
I would
and
not talk about
yeah,
medication use. No,
yeah,
no. Yeah, we'll talk. We can talk about the lab. So was this like in your clinic? Where was this? Your clinicals?
yeah, my clinicals. Yeah,
And why was she so rushed? Was there like a rapid going on or?
there wasn't a rapid going on. I think she was a newer nurse, herself. And so I think she may have had I can't remember. I think it was just two patients, but because she was newer, like it was stressful for her. And I think she was just trying to get all of the orders in that the doctor had placed within like a certain time frame. So I think she had to get labs from that patient on top of the other one.
Um, and by the way, is the interview going to be on Zoom or in person or on the
It's in
phone?
person.
In person.
Mhm.
Okay. Um, so you could say something like, I was, and this was like your nurse that you were following, right?
Yeah.
So were
Actually, no,
you
I was following someone else and she asked me to help her.
okay? Okay, that's great. So you could say, a mistake that I made in my clinicals was when, and by the way, I really enjoy being able to, if I'm able to handle my assignment and also help other nurses on the floor who, when I notice they're busy, I like to say, like, what can I do for you? Can I help you with anything? But I found that I do need to be careful with that because of this event that happened. So I was helping a nurse who had an influx of orders come in. Um, I offered to just run her labs that she had drawn to the lab. And there I could tell there was some confusion about who the specimen had been drawn from. Um, so I asked her, she seemed rushed and a bit confused about it. And I didn't feel right about it. So I went back and double checked with her. And when I double checked, um, we sorted out that it actually was from a different patient that she had initially told me. Um, and I'm very glad that I checked because um, just in the future, if let's say I'm helping out to give a nurse or I'm helping out a nurse to like give a patient's medication, if they say, can you please give this to room 14? And I accidentally, it was supposed to be for room 15, like even though I'm helping them out, it's my responsibility to check the orders if, I'm using my license to care for the patient. Um, something bad could happen if I give the wrong medication, even though my intention is to help. It just kind of was alarming to me that if I'm not careful, something could happen in the future if I'm not really diligent about when I'm helping other people. So it just taught me to always um, double check, even if it's just bringing water to a patient. I double check that they're not NPO,
Okay.
because it could be very easy to make a mistake when I'm trying to help another nurse who's very busy and may not have time to like communicate as clearly as they normally would. So it's just an eye-opening experience.
I
Yeah.
have like a one kind of something similar at my current job that happened where a nurse had to go home and asked me if I could give a injection to her patient. And I got the patient's name and I looked up like their dose and everything just to make sure I had the correct medication and everything. And she said, I think it was maybe like room 4. And I went into room 4 and I said, Hi, you're here for your Xolair. And the patient said, Yeah. And then when I asked for their name and birthday, it was a complete different person. And they weren't even there for that medication. So if I hadn't have checked, like done all of my rights, like my checks, that patient could have potentially been given medication that was not for them. So
Oh,
that,
we could use this too. So maybe
mhm,
kind of frame it more that you made a mistake. Like say like you walked into the patient's room with the medication drawn up. And
mhm.
as you were preparing to give it, you went through these safety checks because it makes it sound like a little closer that it might have happened kind of thing.
So yeah.
Yeah, that's also a really good one. And just kind of frame it as the same thing about how like you really enjoy being able to kind of help the flow on the unit by like when you do have downtime checking in with your other nurses who seem busy and saying like what can I do for you?
Mhm.
But that like you're really careful about it because you've noticed that's an easy way for mistakes to happen. And you always make sure, even though it's not like originally your task for your patient, it is something that you're doing that could affect a patient. So
Yeah.
you're really careful about it.
Okay.
Yeah. And you can say like, is it okay if I talk about a near miss that almost reached a patient? And they'll
Mhm.
say, yeah,
Okay.
yeah.
Thank
Um,
you.
yeah. If we were gonna call your last supervisor or manager, what would they tell us about you?
So they would say that I'm a team player, that I love to help out, which can be like a downfall because I'll get behind on my own work. This was at the nursing facility, so that last manager, and I would get behind on my flow because I would spend extra time with the patients and talking to them rather than just kind of being like a pill shover, like, take your medications. I like to spend the time with them just to make sure too that they were still alert and oriented and nothing new was popping up. So I took my time with my medication pass. Um, Very diligent, hard worker, very clean as well. I always made sure that the cart was clean when I got there, and also before my next shift, I liked to make sure everything was clean and making sure everything was documented too before the next shift came in.
So, you don't have to tell on yourself or say anything negative.
Okay.
Yeah, just say, basically what you said, just minus the negative part. So they would say um, that I kind of went above and beyond in terms of building a really good relationship with my patients. That way, if there is a change from baseline, I know them well enough to notice changes in their orientation. And I would say that I'm really diligent. I
Mhm.
keep my workstation very clean and I'm very like detail oriented in terms of documentation and reporting any assessment changes. Just basically all the stuff that you said.
Okay.
Yeah, because that's all really great stuff.